Welcome to our sonography lecture on renal pathology, part 14 of 14, ureter pathology for the sonographer. Today's lecture will cover stricture, ureter seals, and transitional cell carcinoma. We're going to begin with stricture, and a stricture is when the ureter has a narrowing within it. This typically occurs because a large stone has passed through the ureter, causing irritation along the side of it, and the ureter has then healed itself, creating some fibrotic tissue in there, some scar tissue, and that changes the width of the ureter in the process. Now, strictures are better seen with a pyelogram, which means that a radiolucent dye is injected through the bladder and into the ureter, and then they use fluoroscopy or x-rays to see how that dye fills the ureter. If there is a stricture, there will be a thinner area of dye compared to the area above or below where the stricture is. Ultrasound is not able to see strictures, but what we are able to see is hydronephrosis, which can be a sign of stricture in the ureter. So here's an example of a pyelogram. The dye has been inserted through the bladder and up into the ureter, so we can see how the ureter is filling with that radiolucent dye, and then we all of a sudden see a very thin area here, then followed by a thicker area coming up into the renal pelvis and into the calyces. So the stricture is located at this narrowing in the ureter. Another ureter pathology that we can see as sonographers is something called the Ureter Seal. Now, ureter seals are cystic-like enlargements of the lower end of the ureter, and this is usually caused by a congenital stenosis at the distal end of the ureter. So let's walk that back a little bit. Basically, what we see is in the bladder, there will be this little bubble looking thing right at the area that the ureter should insert into the bladder. So on that posterior part where the trigon is. And this is different from a Foley catheter. Foley catheters usually sit more central and they are aligned up with the urethra. Ureter seals are very thin and lined up more off to the side where that ureter comes in. We're also going to see them all the time. There's no association with like a recent surgery or having a urine bag connected to the patient. So on ultrasound, we do indeed see a cystic structure in the bladder, usually seen more laterally where the ureter inserts. So here's an example of a ureter seal. This is the image of a long bladder. We can see the urine here. The ureter itself is kind of coming down this direction here, coming along the posterior side of the bladder and back up to insert into the trigon area. That is where we will see the ureter seal appear. The last disease of the ureter that we're going to touch on then is the transitional cell carcinoma of the ureter. Again, transitional cell carcinoma is the most common cancer of the collecting system, so that includes the ureter, the bladder, and the renal pelvis. Most commonly, transitional cell of carcinoma of the ureter is seen in men, and typically we're going to see it in the lower third of the ureter. Patients will often present with gross hematuria, painful urine, and pain in the area. Again, ultrasound is not the best at looking at ureters unless there is some sort of dilation of the ureter and it is filled with urine. So again, a pyelogram is the best method to evaluate for transitional cell carcinoma of the ureter. So here's an example of a pyelogram. Again, we can see the radiolucent dye going through the ureter. And what we kind of have here is what we call a filling defect. And because of that filling defect, there is suspected to be some sort of soft tissue mass in the area. If it was a stone, it would show up very differently on x-ray. So because we can't see it with x-ray and we can see that the dye is not filling this area, we do expect that it's a soft tissue mass, most likely consistent with transitional cell carcinoma. It's worth mentioning then above that area, we have a hydroureter, which means that there's lots of fluid in a dilated ureter above the area of obstruction. So this is not uncommon. If this was a stone or even this mass, on ultrasound, we actually probably would be able to see this ureter filled with urine. And that is the end of renal pathology. If you have not seen all 14 lectures, I do encourage you to go back and revisit the lectures that you have missed to make sure that you have covered all of the material necessary.